providing resources and comfort to caregivers. This is Caregiver Crossing.
Hey, good morning, everybody, ladies and gentlemen. Welcome, welcome, welcome. Yes, this is Caregiver Crossing, and I hope you're having a wonderful, beautiful, happy Sunday morning. And if it is your first time to join us here on Caregiver Crossing, this is a show that is brought to you by Joy's House and presented in partnership with our friends at Cardon and Associates. We're glad you're here. This is a show that was created for you, family caregivers, and the people who love them. And we're with you every Sunday morning to discuss all things caregiving. My name is Terry Lynn Stacy. I'm from Hancock County.
My name is Tina McIntosh. I live in Lawrence, and we are in studio with Tempest Wales. Hey, Tempest, can you say hi? She waved. She doesn't want to be on the mic.
But she's going to do it.
Hello, viewers.
That is the nicest I've ever heard you sound. Tempest and I have worked together for years, and she is family to me, and she is on the board today because Candace is unable to be here. And I just want y'all to know that truly is the most gentle and sweet, I would say sweet, that I've ever heard Tempest sound. Glad you're here. Thanks for your help. Hey, if you're looking to find out past episodes of Caregiver Crossing, you can do that at caregivercrossingradio.org, and be sure to like us on Facebook. We put all the stuff in there in between shows. And so I need to brag about something.
Okay.
On Friday the 13th, I had breakfast with Teepa Snow.
There we go. Now that's the kind of people we all should be hanging out with.
She really is lovely.
She is lovely, I'm sure.
If you've listened to the show, you've heard us talk about Teepa Snow, and she came in. Joy's House was able to bring her in on Friday to present to a packed audience.
Good.
We were, packed. Anyway, talking about caregiving, that just... It reemphasizes for us the need to have these conversations. We need to humanize and normalize caregiving. And so that's part of what we're doing here. But yeah, that's my bragging point for the day. I got to have breakfast with Teepa Snow.
Oh, I love that you did.
She's
and I'm
great.
so glad everybody got a chance to listen to Teepa Snow. And when you started talking, I had no idea who that person was.
Yeah.
And then I understood from Candace and you both talking about this incredible human being that is so smart and so willing to share.
You can check her
knowledge.
out. I mean, go to TikTok or YouTube and look for Teepa, Teepa Snow. She's
And
just
who should be doing that?
Caregivers.
All
particularly
caregivers.
who have somebody living with a dementia, but all caregivers. She just is. She's in our industry a rock star. So from one rock star to another, as we were getting ready to come on air, Terry, you told me that you take a bath every night.
Oh, yeah.
I didn't know people really
This
took
is what
baths.
shocked her. Well, listen, I know home builders, and they say people don't want baths anymore, that we just want big, giant walk-in showers. And I still love having a bath. An hour of night. We've talked about where we find our peace, and that's where I find the peace in a bath filled with Epsom salts, all up to my neck.
Sitting in your own filth is where you find your peace.
If I'm doing it every night, I'm pretty sure I'm fairly clean.
Like a film of crud on top of the water.
Only bubbles, only beautiful
Do you do bubbles?
lavender smelling bubbles.
Okay.
And then listen, I am happiest when I'm there, and it's boiling hot. My skin turns red by the time I'm out.
Do you do candles and a glass of wine? Like, are you that person?
Don't need it.
No, just hot.
Nope.
Hot water.
Hot water.
Some bubbles
Yep.
and some Epsom salt, which actually is really good. Does that add something into your body?
And I'll tell you what else. My husband added a fantastic small television in there on one of our anniversary dates. Our days, rather. He added a television.
Yeah, if this was your date, we don't need to know anything more.
And now I just watch lots of great videos. Right now I'm watching True Blood about the vampires because it's scary time of the year.
When you say videos, do you mean like it's a VHS? No. She's here at Tempest.
Yes.
It's a VHS?
Like you put in a disc.
Oh, no, it's a CD. It's got the DVD.
A DVD. Right.
Yeah. Okay,
Yeah.
because I pictured you like, be kind, rewind, like in your bathtub.
No.
Everybody was going to call you to look what was on their VHS tapes, although I do have one of those.
Listen, I think we should stop talking about this immediately. It interests no one. No
I'm
one.
interested. I'm interested. All right, let me tell you what I did last night.
Okay.
It was not a bath, but it was in the Epsom salt family.
Okay.
I made my own concoction to keep me well going into flu and cold season. You want to know more about it?
Is it honey and garlic?
I did that. Yes. How do you know? Not everybody knows that.
Honey and garlic, I'm old.
So you
This is like-
take your cloves of garlic, you put it into some kind of a container, a jar with a tight lid,
Right.
and you put raw, unfiltered, unpasteurized honey, I think is the right way to say it.
Yeah.
And you coat the cloves in it. So that one
Disgusting.
is it's actually not bad. Have you tasted it?
Well, you have to get to the point where you're like, okay, just do it.
It's
because
really
you
not
think
bad.
of garlic and honey together is a terrible combination. But
No,
once you
and
do
you can
it,
cook with it. You can cook with the garlic. You don't have to eat it. You can just eat the honey.
Right. You're
that's
just eating
infused.
right.
I did that, and then I did red onion. And one is for cough, and one is when you feel the symptoms of cold or flu coming on. You take some teaspoons of the honey throughout the day. Yeah.
Wow.
I'm
Wait a minute.
making all kinds of
what was
concoctions.
the other concoction you said you made?
Red onion.
A red onion with honey?
Well, same thing. You just coat the honey,
Right.
coat it in honey.
You
And then
just
you
let
have to
it
burp
absorb.
it. You have
Right.
to like open it and burp it every few days. You have to tip it over, make sure
Yeah.
it's mixing. And then you strain everything out and you put it in your pantry or your refrigerator for like up to 6 months.
I love these kind of remedies.
I do
these
too.
old timey remedies. I think there's something to them, and I love them.
It's part of what I'm studying, herbs and oils and concoctions like that.
Mustard
for
plaster.
our end of life doula program. I don't know what that means, but I'm going to look that up. Mustard plaster?
It's actual, I believe, where you take cloths. This goes back to maybe even Adam and Eve did it, but it was you take sheets of cloth sheets, and you soak them in a mustard type of thing, and then you lay it on your chest.
For congestion?
That and to get the devil out.
Oh, well, that'll work. And then castor oil in the belly button. That's another thing
Oh, I
people are
don't know.
doing. Yeah, I will know more. I will share more as I
can't
know
wait.
it. But I'm serious.
Keep learning.
I had a really bad cough not too long ago. I did the whole garlic and red onion and honey thing, and it was fantastic. I made one of my garlics last night with cayenne pepper as well. Well, red pepper flakes. And so they say that's also good. Okay, we're going to have to take a break.
Okay,
We'll
go.
be back here in a moment. We'll talk about something else, I promise, maybe Friday the 13th tattoos, but more here in just a moment on Caregiver Crossing. Stick around. You are listening to Caregiver Crossing, a show designed for family caregivers and people who love them. Caregiver Crossing is brought to you weekly by Joy's House in partnership with Cardon and Associates. We are here every Sunday to bring you support, education, and hopefully a good laugh. Visit caregivercrossingradio.org to connect with us, hear past episodes, learn more about caregiver support resources in the community, and much more. That website again is caregivercrossingradio.org. Don't go anywhere. We'll be right back with more Caregiver Crossing shortly. We're back on Caregiver Crossing. I'm Tina McIntosh. I'm in studio with my friend Terry Stacey, the Whistler, and Tempest Wales, who was working the board today for us and tolerating all of our nonsense. So we're going to talk about an article that we've been studying called Managing Responsibilities in the Sandwich Generation. And this is by Ruby.
What?
How do I say her last name?
Cemental.
Yeah, that's right. With Caring Senior Services. And so this article is really, it talks about the fact that caregiving for a loved one, it often sneaks up on us.
No way
particularly
to
in
prepare.
There really isn't. And who wants to prepare, right?
Yeah.
I mean, that's what we hear people say often.
right.
So you're on one side or the other. Some people are like, I don't want to think about this. I don't want to talk about this. I don't want to talk about somebody getting older or having a diagnosis. And others are like, I'm absolutely want to prepare and do all of the things. What side are you on?
I was on being a part of this show and not realizing that I would need it someday. And it absorbed inside of me through my skin, through my pores. And then it was there when I needed it.
Yeah, your muscle memory for real was very strong when it came to
you don't even
caregiving.
know, but you've been such a good mentor and teacher that I didn't even realize how good until the time came when you needed to be a caregiver of some sort.
Yeah, it's been beautiful to watch you through experiences.
Thank you. And everybody, I mean it. If you're driving around the car and this is what's on and you don't even know it, you're absorbing it. And it hopefully will help you at some point, because I believe we'll all be a caregiver at some point in our lives.
Well,
I do.
I mean, here's the reality. In this article alone, it tells us that currently 25% of American families are dealing with elder parent care issues.
Right.
So not only do you need to know, and that number is going to get stronger as we go on, by year 2030, there are going to be more adults over the age of 65 than there are children under the age of 18. And I want you to stop and think about that. By the year 2030, 6-7 years away, there will be more adults in our nation over the age of 65 than there will be children under the age of 18. Let's get it together. The president actually put out an executive order on April 18th of this year, basically saying, hey, America, we got to get ourselves together when it comes to caregiving. And if we don't, we're in a world of hurt.
And I hope, and here again, it's something that people don't want to talk about. Mm-hmm. That subject is not sexy, I say, you know what I mean? It's not something that, you know, that you want to, that you, when that information came out, everybody was like, yeah, okay. Mm-hmm. It's like preparing for, you know, to write a will. You don't want to talk about writing a will. So you don't write a will. And then all of a sudden, what do you need? A will.
And it's too late.
It's the same thing.
Well, let's talk about, there are some great tips in this article, and some may be very recognizable by you, and others might just really hit you in a spot you never imagined. So, Terry, why don't you get us started? Pick one that really struck you.
Understanding elder issues. This is something that this show, again, has brought to attention, the elder issues. Otherwise, I would have not known, you know, about the sandwich generation needing to have a clear understanding of elder issues. And will that help you and reduce that stress you may need? I don't know, but you'll be more prepared, I think.
It won't be such a shock to your system. I actually met 3 young men last weekend, all ages 22 to 26, 2 of them from the United States, 1 from Chile, and they are all working in the area of Medicare and Medicaid. And I couldn't believe
Bless their hearts.
I said, tell me why. And they said, well, it's so needed, and we want to protect people from getting scammed and, you know, all the issues out there. And then they went on to talk about, with sincerity, how much their group of friends, and particularly these 3 guys, sit around and talk about ways that they can make the world a better place.
We need to hear them on the show.
They're coming.
Are they coming?
I actually got a voicemail just earlier this week from one of the guys. Yeah, I mean, really, really fantastic. So, another one on here is recharging emotionally. You know, Dr. Malaz Bustani, who's in Indianapolis, Indiana, one of the things he talks about that is imperative for caregivers if they want to take care of themselves, and we all should, is that you have to have 8 consecutive hours of respite. That's 8 hours in a row of relief every week. That doesn't mean an hour here, 2 hours there. It means 8 hours back to back.
How do you find that?
Adult day. I mean, that's a huge option, right?
Yeah.
When people bring their loved ones to Joy's house or other adult days, there are your 8 hours. And so you've got to have a break from caregiving. It's very important.
Don't end in guilt. You know, this is one of those other things, because you just said, okay, I'm going to take 8 hours away and put them someplace safe where somebody can care for them for a minute. But I bet there is a lot of, maybe not a lot, but for a fleeting moment, you might think, oh, I can't do that.
Yes. Let that go. I mean, really, you got to let that guilt go. Asking for professional help. I'm going to tell you, you've got to be specific. And so this article talks about, you know, asking for help in the form of respite care, even from older children in the family, is a really good thing to do. And I'm going to tell you professionally and personally, you know, talk to the medical team that you're working with about what help is out there. They might know something you don't know about already. And so, Terry, if you could get help with anything right now, what would it be?
As far as caregiving goes, or just anything?
Yeah, just anything.
I just need another arm.
Well, let's, can we cut that out, Tempest? Can we do that? Because I'm not sure how to get her another arm. What would the other arm do?
It would be the other arm would be the one that could do other things that I can't get to because I only have 2.
Okay, that's fair. Well, mine is cleaning.
Same thing.
If somebody would
What
just
if you
come
had another
clean my
arm?
house,
What if you
it
had a
would be
third
attached to
arm?
my body and then I have to be there to do it? Like, I'm just saying, I don't want to do it. I want somebody else
Do you
to
want a
do
robot
it.
arm?
No, I want somebody
That's
to
on
clean
wheels?
No, just listen,
could
you
push
and your
the
3
vacuum?
arms come over to my house and clean and we'll both be happy.
That robot arm could push the vacuum.
It's a bad idea. What else is on this list?
Mapping out your finances. And here's the thing, again, we're talking about the sandwich generation. You're caring for your kids and then you're also caring for mom and dad. And there are ways to save for college tuition and care for your loved ones, it says, but manage everyday spending money and create that budget for a various number of scenarios. Like mom needs an in-home caregiver, or dad needs to be moved into an assisted living facility, and considering all your options for each of those scenarios. And I know that's hard to do, to prepare and budget, but this is on the list.
It is. Another one is hold regular family meetings. And there are a lot of apps that can help you with this, but talk realistically. The article says with your parent about the time you spend caring for your children and financial responsibilities. Again, this article is really focused on the sandwich generation, those who are sandwiched in between caring for an aging loved one and a child. It also says, likewise, talk with your children about how their lives will be affected by the growing needs of your parent. And I think that is huge. And then the last one is set realistic goals. And Terry, what does it say about that?
Understanding that there's just 24 hours a day, every day, and every minute is important, obviously, but making a list of the things that are necessary each day, your work schedules, the needs of your parents, the needs of the kids, the needs of your spouse, and then don't forget about your own needs, but set realistic goals. And that can be tough if you're dealing with responsibilities in the sandwich generation. You learn how Caring Senior Service can help. And they're a good organization that can help you too. But again, Joy's House is here for you when you need them.
And you can email me anytime at Tina, Tina, @joyshouse.org.
We welcome to Joy's House studio Ramita Tandon. She is the Chief Clinical Trials Officer with Walgreens. Ramita, it's so good to have you with us today. How are you?
Good. Great to be here, guys. Thank you for having me.
I have to say, I had no, and Tina, maybe you did know, I didn't know that Walgreens was doing clinical trials. And so I think this part is very interesting. Tell us about your career path that led you to Walgreens.
Yeah, I've spent over 25 plus years in the healthcare life sciences space, and namely focused in the drug development life cycle and really trying to find innovative ways to disrupt this entire R&D cycle and try to find ways to get drugs and new therapies out to patients a lot faster. So my career has been centered around focused on the patient. How do we bring, these novel therapies into patients' hands faster, and leveraging, innovation that's out there, whether it's data, technology, digital, types of tools, whatever it is just to make it more accessible and more convenient. I spent a lion's share of my career in the clinical trial space, really trying to, again, figure out better ways to, accelerate these pathways. And so when the opportunity presented itself from a Walgreens perspective, I thought it was a fantastic opportunity to take on that role as the Chief Clinical Trials Officer and build and lead this brand new, franchise within the larger organization as part of our healthcare transformation that we're going through in the last couple of years.
It's big. I mean, so Ramita, this is Tina. And when I think of a clinical trial, and I'm going to stay away from just Walgreens for just a minute. I know that's hard to do, but when I think of a clinical trial, it's kind of a mystery to me. I have one of our dear friend just started a clinical trial, and he went to the doctor, and I said to him, "What happens next?" And he said, "I don't know. I just know that the drug that they're going to give me was just named last week." And so just kind of, if I were a little kid, I'm a kindergartner, how would you explain what a typical clinical trial is?
Yeah, that's a great question. And it's very common for people to feel like this. Less than 5% of this nation participates in clinical trials. So I'm not surprised that people don't have the awareness of just the simplicity of, what a clinical trial is. And essentially, it's just a research study that tests, with a new drug, a new device, diagnostics. But it goes through a series of investigational processes and steps to make sure that before the drug is approved and in the hands of our consumers, that it's safe and it's effective. And so, it's done in a very controlled environment. There's a lot of rules and regulations that govern this entire research enterprise, because it's meant not only to protect the integrity of the enterprise, but also the patient's safety. So, we tell people that this is an opportunity for patients who are on therapy that has not been working and they've not seen a better quality of life or good outcomes. It's another care option.
Yeah, it's kind of people raising their hand, right? To say, I will try this clinical trial. Nothing else, like you said, nothing else is working. I will try this clinical trial. And I'm also then helping, the collective group to make decisions about what might help hundreds and thousands of other people, right?
Yeah.
Yeah, that's huge, right? Because, again, like that stat I said, that less than 5% that participate, and then those that participate, 75% are Caucasian, which means a lot of our Black, brown communities who've never been given an opportunity or have had that dialogue with physicians or their providers, have never been given a chance. So this is an opportunity to be able to be part of, a care pathway that actually might impact their outcomes positively than what they're dealing with today on a day-to-day basis with the disease.
But what are some of those common barriers that minorities face when participating in medical studies?
It's a great question. And, look, during the COVID-19 pandemic, we learned a lot, right? It was not a one-size-fits-all strategy when the retail pharmacies were tapped to administer the vaccinations. And we learned firsthand that many of our communities that are in these underserved areas, have travel barriers, technology barriers. There's health literacy issues, digital literacy issues. There's such a divide, and depending on the parts of the nation that you're at, it's very different. Those conversations are very different. And so traditionally, clinical trials has been done at these academic centers or these, physician organizations that are sometimes too far for patients to travel. We have single mothers that have childcare issues, right? So they can't just pick up and take 2 buses to get to a Mayo Clinic or some other institution. It's just not convenient for them or accessible.
I have to tell you, I'm married and, have children and work and all the things. And I've got some things going on. They wanted to send me to Mayo, and I couldn't figure out how to make 10 days away from my family and business, and the cost of it work. I can't imagine being a single parent trying to do that, or it is too much. And so one of the things, you're hearing the voice of Ramita Tandon, who is the Chief Clinical Trials Officer at Walgreens. And you're going to stick around with us, Ramita. We are really, really interested to hear why Walgreens and what is Walgreens doing? Because, when I think of Walgreens, I think of Walgreens as this incredible 4 walls, usually on the corner of some intersection where I go to get care and get products, and it's in the community. And so this idea of Walgreens doing clinical trials, I will, first of all, before we take this break, apologize if I have totally missed something on that. And we are really eager to hear more. You have said the word twice, I think, of really looking to disrupt the clinical trials ecosystem and rethinking how everything is done. And we are so eager to learn from you about that. Did that strike you too, Terry?
It did. And that's why I said to you in the beginning, I said, you know what? I had no idea that Walgreens was involved in clinical trials. Yeah. And I'm sorry, you started to say something. Please, Ramita, finish what you were saying.
No, I was saying you guys set up the framework just beautifully, and we can talk more. But there's a lot behind the why of why we're wanting to do clinical trials, and certainly, Walgreens is very uniquely positioned to disrupt and transform that ecosystem. So, look forward to talking more.
Well, stick around, everybody. We will be back with Ramita Tandon, Chief Clinical Trials Officer at Walgreens, and cannot wait to hear about this future and the changes with clinical trials. So stick with us here for just a moment.
You're listening to Caregiver Crossing, a show designed for family caregivers and the people who love them. Caregiver Crossing is brought to you by Joy's House in partnership with Tandon and Associates. With 20 communities owned, operated, and managed in the Midwest, and more than 40 years of senior living experience, Tandon and Associates provides residents with the best senior living options and personalized service. Visit cardon.us for more information and to find a community near you. Stay put. We'll be right back with more Caregiver Crossing after the break.
We're back on Caregiver Crossing. I'm Tina McIntosh in studio with Terry Stacy.
Hi.
And this is a cool conversation that we're having. So if you're just joining us after this break here, we want to introduce or reintroduce you to Ramita Tandon, who is the Chief Clinical Trials Officer at Walgreens. And get this, you guys, Walgreens does clinical trials, and they're interested in doing them better and differently than how we think we know what they are. And so, Ramita, thanks for sticking around with us.
Thanks for having me.
All right, let's do this. Yeah. So, Walgreens has been doing clinical trials for how long?
We kicked off our tech-enabled business about 2.5 years ago now.
I am so sorry. I really feel like I owe Walgreens an apology. How do we not know?
Well, we just didn't know, I guess. And truly, we didn't know. So how does this work with Walgreens?
In 2021, we as an organization made an announcement in our move into healthcare. And, in part, the COVID-19 pandemic, when everything was shut down, the retail pharmacies were tapped to become the vehicles to administer, over 300 million vaccinations across the nation. And we learned a lot. For those that, are not familiar, Walgreens has 9,000 stores and pharmacies across the U.S. We service roughly around 110 to 120 million consumers that are part of our ecosystem. 78% of the U.S. population is within 5 miles of Walgreens. And what we learned during this, pandemic was that people wanted healthcare, or just to be able to have access to the vaccines and just to be able to connect with somebody that they trust, and can go in and get information was their pharmacy. And so, our goal was, what can we do more? And so our announcement in 2021 was to start to create this healthcare continuum where we have a suite of healthcare services that are being deployed within our locations. So we have roughly around 250 or so healthcare destinations today that deliver low complex visits. So services like screening, diagnostic, and lab draws. And the idea is, how do we start to deliver healthcare more locally, convenient, and make it more accessible?
Yes.
And start to close the care gaps that we see in many of our communities across the nation.
And what I hear when you say that, Ramita, is one, I have noticed in the last couple of years, the steps that Walgreens has taken to be that local in the community. And maybe for me, when I think of the clinical trials and stuff, that feels so big and far and foreign. And Walgreens is just right here. Those are our people, right? We know the pharmacist and we know the woman at the front who says hello when we walk in. I mean, it's a very comfortable place to be. What I love that I'm also hearing you say is, we learned a lot and we want to do more in our communities and making it more accessible. And so you told us last segment, the unfortunate thing that I think we probably already knew, but hearing it hits different. And that is that people of color are not involved with these clinical trials and involved with the healthcare as much as we want. So is that one of the big things behind this change in strategy?
Yeah. So when we launched the clinical trials business specifically, it was, how do we make sure that we can, number one, have people view this as a care option and not this scary research, lab oriented type of, activity, but more importantly, how can it benefit your health? So we wanted to make sure we're driving awareness about what a clinical trial is, how it can benefit you and your health. And we wanted to leverage our physical footprint, so our stores and pharmacies, as a mechanism for people to come in, have a conversation with the pharmacy care teams or other specialists that are on the ground in those locations to answer those questions. I mean, there's parts of our nation that are familiar with clinical trials, but have fear, have a mistrust because some of the historical atrocities that they've endured over the years because of being part of trials. And so our first step is to make sure that we can educate and empower these communities so they can feel comfortable and informed and make a decision. And once they make a decision to participate, then they're able to come into the stores and to be able to have clinical trial services, again, with screening, diagnostic, or lab draws, things of that nature.
Ramita Tandon is with us. She is Chief Clinical Trials Officer with Walgreens. Excuse me. Can you give us an example of some of the clinical trials you've done or what you've got coming up right now that people can get involved with?
Yeah, we have a number of trials that are underway today. Certainly, we have some COVID, vaccine trials. We have diabetes trials. We have Alzheimer's trials. We are kicking off some obesity programs. So it's an array of different types of disease areas. A lot of the disease areas that impact the swath of the nation. So it's very relevant. We're actually kicking off some early cancer screening diagnostic trials. So people will be coming in for some testing on early cancer detection, which is pretty cool.
Incredible.
And, some of the trials that we've completed, we've seen some incredible results and outcomes that show that we are surpassing the number of diverse patient populations that are participating. So what it's showing us in the early readouts that, our communities are actually liking the fact that they can come into our locations, learn, and then make a decision to participate. And then the outcomes are showing, quite significantly our minority patient populations actually signing up, surpassing the FDA statistics that show that they're in single digits, for our Black, brown patient populations.
Incredible. Ramita, we are going to have to go here in just a moment. We're reaching the end of the show, which makes me very sad right now. How do people find out about these trials?
You can go onto our website at walgreens.com, search for clinical trials, and we have a whole separate section where people can then locate trials that might be of relevance for them, or click on the QR code there and you can learn more information and we can have a chat with people.
We're going to make sure to share that through Caregiver Crossing as well, because we want to keep that, in front of people as we go forward. But I just want to take a moment to say thank you for the work that you are doing, Ramita. It's incredible. And the efforts that Walgreens is making to change not only who Walgreens is, but the community when it comes to clinical trials, because you all are making a very big difference. And so we're really grateful for what you're doing.
Thank you for having me today.
Absolutely.
As we close the show, just want to remind our listeners that they can contact Tina McIntosh, for more information and resources to help you through the journey of caregiving. Do that by sending her a note at tina@joycehouse.org, or you can call us at 317-254-0828.
I want to say thank you to Cardon and Associates for sponsoring Caregiver Crossing. We will be back next week, and we hope you will join us right here.